Environ Life Science Limited, partnering for life.
Hi everyone, my name is Amanat Kagzi. I'm a dietitian practicing in Surat, Gujarat, working pan world with the help of our mobile application. Today I am here to discuss an important topic in the nutrition field, that is a dietary supplement. The world is very big about it. It's overwhelming to see the countless options available on Amazon, other websites, the medical stores, the people recommending it. And yes, there's a lot of confusion as well. I'm here today to solve this confusion and give you more information. When you are more informed, these supplements are going to be more beneficial to you. So rather choosing just because it is on advertisement or just because it is being greatly marketed, let's be informed. So the first thing is always ask to me, why should we take these supplements? The role of the dietary supplements are to take your daily intake of nutrients. So say we are eating food and we think that these are giving me the vitamin A, E, C, D, but in general and in fact, in reality, your body is not 100% capable of absorbing these nutrients, and hence the gap. So these are the supplements intended to augment your daily nutrient intake of your vitamins and minerals, and they are available in various forms today: capsules, tablets, powders, liquids. So their role primarily is to fill the nutrition gap. That is, you are unable to meet your nutrients through the food alone. The second thing, it is needed to correct the nutrient deficiencies, like that can have a serious implications on your health. Say vitamin D deficiencies. If you are living in certain area, or maybe you have a lifestyle where you're not going to be exposed to vitamin D, what will you do? If you do not supplement it, you're going to have a brittle bones, you're going to have a lot of hair falls, your other system is going to be compromised. So it is going to impact the entire system of yours. Hence, this is necessary as a deficiency provider. Now, the third thing that you need is for the special medical conditions. For an example, folic acid supplements, they are often recommended during the pregnancy to prevent the birth defects, right? So these are something that is going to support you for particular medical conditions, and they are mandatory to enhance your performance, say for the athletes. The athletes are already very fit, but to optimize their performance and the recovery post and pre their sport, this is very important. Say a protein supplement, say the recovery aid, the antioxidants, these are very important, as well as for the hydration, the supplements like electrolytes are supplemented. So first role is to give the dietary supplement to fill the gap. The second thing we should also understand, is this beneficial to me? Should I be taking it, or I am just following the trend? So while I say it is crucial to know that one size does not really fit all. So say you are seeing a lot of advertisement about the collagen. Still, you really need it or not is the question, right? You can also see your reports, the medical blood reports of yours, and see whether you need it or not. Or you can also judge it by some symptoms. Basic vitamin as multivitamin. You need it for your immune support, for your bone support. So these are something you can always have. Vitamin D, on and off, you should always supplement. As we all know, we are most of the time in the AC, sitting in the offices, or we try avoiding going to sun, or we use the sunscreen. So in that case, we have to have a vitamin D. Omega-3 fatty acids are very essential for your heart health, for your cognitive functions. And for this source, fish oil is the best source. All right. Calcium must benefit you all, as it is important for your teeth, your bone, and especially if you are not fulfilling your needs through the natural food. Iron supplements today are needed, especially with the children. You should see iron deficiency anemia. Females with the pregnancy or with the period where they have a lot of heavy bleeding during their menses. So these are somewhere you should see whether these supplements are going to be beneficial or not. The third thing is, when you consider these dietary supplements, you should also know whether they are safe for you. Are these supplements, the selection is going to be effective for you or not? You must consult first your healthcare professional, say it a doctor or a dietitian of yours without their consent, and have a proper regime set with them. When to take and how long to take is very important. Also see the quality of the supplements that you are going to select. The brands that you are seeing, check the labels, check the certifications, lab testing. Do not literally fall for anything and everything available on the list. Then very importantly, you also have to see the dosage and the timings which your practitioner will suggest you, and follow only that. Don't overdo things. When you take supplements, it is also important to know that when you overdo it, when you overdose it, it is going to be harmful than beneficial. Hence, the dosage setting is very important. You have to be very mindful with your timing also. You cannot just club every supplement together and have a handful of them. Every supplement, whether they are supposed to be taken post your meal, pre your meal, or maybe at the night, these are something you have to know to be really effective for your timing and the beneficial. Next thing, also consider if you are into any supplements, then you also have to see whether your diet that you are going to eat is healthy or not. Is it aligned with the supplements that you are going to take or not? Because the supplement that you will take, if your diet is not aligned with it, it is again a waste. Supplements again is not a replacement to a healthy diet. So don't put a lot of stress on consuming a supplement. Rather strive to get most out of your natural food and fill the gap only. So always beware of the potential interaction between the supplements and the medication also. If you are on any medication since long time, then please see whether the supplement that you are going to consume have any interaction with these things, any interference with these medication, because then it is going to do harm than good. Discuss with your medical provider. If you are consuming a newly supplement and you see any allergies, you see any sensitivities, please stop them and consult with your practitioner. Supposed to discontinue it instantly. Also, when you promote certain ingredients to your friends or advocate them, please also inform them to consult their practitioner before they start consuming it, because you benefited, doesn't matter, the others are also going to be benefited. Research and read the labels when you consider any supplements. The amount that they are claiming in the front of the label, say 1000 milligram, is it really having 1000 in that one capsule, or you're supposed to consume 3, is very important. So these are some tricks that you will always see on your labels. Okay, labels are decisive, so you need to check it properly. Second thing, always check the expiry date. So the supplements also has an expiry date, and this can affect on their safety and potency, right? Don't use the expired supplements. Also know the source. Is it vegetarian source? Is it non-vegetarian source? Is it trusted source? Because these are something very important. Also being tested for contaminants or not. This will ensure your safety when you consume it, right? Considering the form of supplement you're taking, say you're taking the pills, you're taking the capsules, you're taking the liquid, you're taking the powders. Choose what is more convenient and choose which has more absorption in your body, and digestibility is very important. Be cautious with the claims. You will see a lot of advertisement coming on Instagram, YouTube, even on the television, claiming a lot of things. But is it real? A lot of people today are claiming a lot of supplements. These are for the woman only, woman friendly proteins. Friends, also understand for supplements, there is no differentiation between the genders. One is for all. If protein is a protein, The female doesn't need a different kind of a protein. A male doesn't need a different kind of protein. Yes, the quantity, the amount may differ. The molecules doesn't differ. So these are only the marketing gimmicks. Be aware, right? Follow the recommended doses. Like I said, avoid taking it in excessive and do not do under. Do not consume what is not even needed and because just in a trend. Your individual need tailored to a specific requirement, working with the person who can consider your age, gender, your medical conditions, your dietary habits, your geography, and your work life is very, very important. So when we conclude this session, your dietary supplements have a very important part in promoting your health and addressing the specific need, but it does not replace your balanced diet. Make informed choices. I have given you a basic of all the things that you need to consider when you choose any supplement from the market under any circumstances. Always consult with the healthcare professional to determine whether you need them or not and their dosages. So as we conclude, I would also like to extend my thanks to the team Environ for giving me the opportunity today to impart a little of my knowledge on supplements to everybody out here. Hope you all benefit, and yes, you can connect with us anytime you need a guidance about it. Thank you very much.